Apparently, there's a strong link between obesity and disabilities. So I want to share some quick stats with you that I found on the CDC website that pertains to people with disabilities and obesity. Here are those stats. Children and adults with mobility limitations and intellectual or learning disabilities are at greatest risk for obesity. Another stat is 20% of children 10 through 17 years of age who have special healthcare needs are obese compared with 15% of children of the same ages without special healthcare needs. So 20% of children 10 through 17 with healthcare needs are obese. That's a high number. So if you have healthcare needs, you have a 1 in 5 chance of being obese if you're through the ages of 10 through 17. Last stat here is annual healthcare costs of obesity that are related to disability are estimated at approximately $44 billion. Obviously, that means that a lot of health complications arise from being obese, which means you're going to be spending money at hospitals for healthcare, kind of solving the damage you're doing to your body, which means that the health industry actually is profiting a lot off of disabilities and obesity. But, it's not just people with disabilities, though. Here it says more than 1/3 of adults, which is more than 72 million people, are obese in the United States. That's so many people. So if you're struggling with obesity and weight gain, you're obviously not the only one. A lot of people are. And I'm not shaming you or anything. I'm just telling you that statistically there is a link to obesity and disabilities. So if you are disabled, just know you are more at risk for becoming obese. So practice, healthy habits, diet and exercise to prevent obesity, which means avoiding sugar, which can cause the diabetic problems, which affect your whole body and your eyes. You are what you eat. That's a classic phrase, but there's a lot of truth in it. And this article ends talking about the challenges facing people with disabilities. It says people with disabilities can find it more difficult to eat healthy, control their weight, and be physically active. This might be due to a lack of healthy food choices, difficulty chewing or swallowing food, medications that can contribute to weight gain, weight loss, and changes in appetite, physical limitations that can reduce a person's ability to exercise, pain, a lack of energy, a lack of accessible environments, for example, sidewalks, parks, and exercise equipment that can enable exercise, and a lack of resources, for example, money, transportation, and social support from family, friends, neighbors, and community members. So yeah, that's the common, challenges people with disabilities face in terms of why they seem to, put on weight or become obese. If you are disabled, I think you have to be creative. I think you have to be cognizant and intentional with your choices to avoid, these common pitfalls and, to protect your health. Like I said, you can't control that you're disabled, but you can control other, extraneous things that are going on with your life in terms of your diet and exercise. So if you can't exercise, maybe be more mindful of your diet. There's little things you can do. And I know there's not a one-size-fits-all solution to avoiding, weight gain and obesity, but at least think about it. Maybe you can figure out ways to improve your situation. I think if you're feeling healthy, you're feeling good, you're going to be, a happier person.